Good afternoon, everybody. I'm Muriel Bowser. I'm the Mayor of Washington, D.C., and today we are providing a response on the district, a briefing on the district's response to the COVID-19 pandemic in the United States. Today, we are sad to announce the first death in Washington, D.C. related to COVID-19, and we certainly want to extend the condolences of the entire District of Columbia to the family. Let me be clear, we expect to see a spike in COVID-19 positive cases in the coming days and weeks. Last night, we jumped from 39 cases confirmed to 71 cases confirmed. In that number, we have reported that 3 of our first responders, part of our fire and emergency medical service, have also tested positive. And we have talked about its ramifications for fire and EMS. I also want to announce, based on many discussions with our health team and our expectations of continued social distancing, that I am modifying government operations until April the 27th. So with that, schools will continue distance learning through April 27th. District government will continue teleworking and operating in modified status. And we will continue the ban on mass gatherings. I cannot stress enough that the threat of this virus poses very serious consequences for our community. And everyone is susceptible to being affected by this virus. It does not discriminate based on age, race, or gender. Everyone can get it and pass it on. As we head into this weekend, we're calling on everyone in our community to do their part to slow the spread. Stay home. More than everything, we need anyone who is not performing an essential service or activity to stay home. Don't treat this like a normal weekend. There will be more weekends, more nice days, and right now we're all focused on flattening the curve. In just a matter of days, our lives have been upended, but our sacrifices, we know, will save lives in our city and in our country. We are in this together, and we will get through it together. And when we get to the other side of this, our city will recover together. So I am asking you to continue to check coronavirus.dc.gov for updated information. I'm going to ask now our Director of Homeland Security and Emergency Management to provide a briefing and introduce our speakers.
Thank you, Madam Mayor. Good afternoon. My name is Christopher Rodriguez. I'm the Director of the D.C. Homeland Security and Emergency Management Agency. In addition to what the Mayor just briefed out, we're also going to be providing briefings from D.C. Health on the status of healthcare and hospital preparedness. A number of district agencies, partners, and stakeholders are working right next door in the district's Emergency Operations Center located at the D.C. Department of Health. And I want to assure you that the public servants who are there are working 7 days a week, around the clock, to ensure that you, our residents, have the best information to keep yourself and your loved ones protected. As I mentioned, we're here to discuss preparedness measures that our hospitals are taking to combat COVID-19, some of the impacts to our schools, the resources available to aid in the district's economic recovery, as well as the steps residents can take to enroll in the district's unemployment compensation process. Before I turn it over to Dr. Nesbitt from the D.C. Department of Health, we also want to highlight an important action that our community can take to help us during this COVID-19 incident. The American Red Cross is facing a blood shortage due to a number of blood drive cancellations in response to the coronavirus outbreak. We encourage residents to show the nation our D.C. values and donate blood if you are able. For more information, please go to redcrossblood.org. And with that, I will turn it over to Dr. LaQuandra Nesbitt, the Director of the D.C. Department of Health.
Thank you, Director Rodriguez, and thank you, Mayor Bowser, for your continued leadership during this most difficult time. I'd first like to express my deepest sympathy to the family of the man who passed away this morning due to COVID-19. He was a 59-year-old man with a complicated medical history who experienced symptoms of COVID-19, including fever, cough, and shortness of breath, who was admitted to a local hospital just a week ago. This individual was tested upon admission to the hospital and then had repeat testing done through the district's public health laboratory, where the test results were returned with a positive test for COVID-19 on March 18th. The individual did not report to us a history of travel, recent travel, and was identified as potentially having contact with a previously positive case of COVID-19 in the district. This untimely death related to COVID-19 underscores the important points that Mayor Bowser has mentioned. It is very important for the social distancing practices that we have put in place to be adhered to and taken very seriously by members of our community so that we may protect other members of our community from COVID-19. Over the past few days, I've spent time with the leaders of our hospitals and healthcare systems in the District of Columbia, speaking with them about their plans to respond to COVID-19, the capacity in our healthcare system, our ability to provide critical care services in our hospitals, the medical surge capacity, and understanding any needs that they may have as it relates to medical supplies, including the ability to offer testing. Some of the things that have been identified is the ability to provide testing and the use of commercial laboratories. As was evidenced in this particular case, we know that the public health laboratory in the District of Columbia remains a go-to laboratory for testing of individuals who are in inpatient environments. And we have extended the invitation to all of our hospitals in the District of Columbia to use the public health lab that can provide results to hospitals in the District of Columbia within 24 hours of receiving a sample. This is critically important because during these times, we need to be able to conserve personal protective equipment, often referred to as PPE, for our healthcare providers. We also need to be judicious in the use of the healthcare resources that we have, such as negative pressure rooms. And we also need to make sure that we're protecting the health and safety of our healthcare personnel. When they are impacted by COVID-19, it further strains our healthcare resources, for we need our healthcare workers who are on the front line of this response to remain healthy and to be available to take care of all of us if we require such care. The medical surge planning continues in the District of Columbia as it has for the past couple of months, with our healthcare providers being able to use innovative ways to deliver care, to being prepared to have an increase in the need for emergency care services, and that includes being able to do things such as suspend elective surgeries, encourage patients to use other modes of healthcare delivery, such as the use of telehealth services, in lieu of the patients coming into the healthcare environment for non-essential services, and also being able to explore alternative care space on their healthcare campuses. You may see this manifest as the use of tents or triaging patients in a different way when they come into the hospital. So triage may be external to the hospital instead of in the hospital space, to be able to separate COVID-19 suspected patients from patients who are coming to the hospital for other reasons. Many of our hospitals, in fact, all of our hospitals, have implemented visitor restriction policies. While we understand that some people may view these policies as burdensome and wanting to visit their loved ones in the hospitals, these policies are implemented to be able to protect the safety of patients as well as healthcare workers. So we ask for your patience in being able to comply with these screening policies that are designed to make sure that people who are sick, who are experiencing symptoms of COVID-19 or who have a history of recent travel are not bringing COVID-19 into hospitals and causing harm to patients and to employees. All of these things, again, help us reduce the transmission of the virus, as well as helping with our PPE conservation efforts. Mayor Bowser, as well as the team at DC Health, have been very vocal advocates of helping to access the supply chain to meet some of these needs that our healthcare providers in the hospitals as well as in the primary care community have expressed to us. DC Health has the capacity to access the Strategic National Stockpile, which is a federal asset that is designed to help communities when there is a shortage in supplies. We have made an initial request for specific supplies such as N95 masks, surgical masks, gowns, face shields, gloves, and other PPE that is necessary to care for patients suspected of having COVID-19 and those who have been diagnosed with COVID-19. The district understands the importance of acquiring this personal protective equipment and supplies and distributing it to healthcare providers most in need of this equipment. We have received an initial allocation and distributed the initial 5,000 surgical masks to healthcare providers most in need. We have also made a request for 10,000 swabs or test kits for healthcare providers and are awaiting a response from the federal government. Lastly, I want to highlight other things that we know of critical importance as we watch what is happening around the globe. On a daily basis, we are in contact with our hospital community to better understand what the need what the capacity is in the hospital system if we were to experience a surge. We ask about the number of hospital beds that are available to care for our residents, with a special focus on the number of intensive care unit beds available, as well as ventilators that would be available if patients were to acquire assistance with breathing during their hospital care. We have been able to assess that due to patients heeding our message of calling ahead when you are sick, getting an assessment from your healthcare provider, and staying home if you do not have a medical emergency, our hospitals are able to become even more prepared in the event that we have a surge in the demand of healthcare services related to COVID-19. Because of this ability for our patients and our residents to use the healthcare system responsibly, we have assessed that we will be in a position to be prepared for that increased demand for healthcare resources. We have also assessed that the number of ventilators in the District of Columbia exceeds the number of ICU beds, which tells us that our hospital leadership are thinking very creatively about how to use the space in their healthcare facilities in different and new ways to respond to COVID-19. I want to assure you all that I have been in contact with all of the hospital leadership. I have conducted site visits. We have been in touch with the workers who are on the front lines to be able to understand what their needs are, and we will continue to do so as we work collectively to respond to the impacts of COVID-19 in the District of Columbia. Thank you for your time and attention, and I'd now like to turn it over to Deputy Mayor Paul Kine for further updates.
Thank you, Dr. Nesbitt. Thank you, Mayor Bowser, for your leadership during this time. Throughout this evolving situation, Mayor Bowser and her administration have made school-related decisions based on the best available science and in close consultation with DC Health, with the Chancellor and DCPS, OSSI and the State Superintendent, and charter leaders from across the district. In an effort to help stop the spread of coronavirus, or COVID-19, the district's public schools, as the mayor mentioned, will remain closed through April 24th. Classes will resume on Monday, April 27th. This decision reflects the extraordinary circumstances that the district and the nation is facing together, and we realize that families are being presented with new challenges, and we will continue to offer supports to families as we work through this. The CEO of Friendship Public Charter Schools, Pat Brantley, is here with us today, and we greatly appreciate her partnership and that of other charter leaders throughout this dynamic situation. And we want to reiterate that it is our full expectation that public charter schools will follow this updated DCPS operating status. To be clear, this extension of this closure comes with an expectation that teaching and learning will continue. The district will continue to work with schools to build upon and expand consistent methods for remote instruction of students. Distance learning is new for many of our schools, and we are working to address challenges where they exist to increase the rigor and effectiveness of this distance learning. And equally important, our message to families and students, as the mayor mentioned, is that it is very important that you stay at home, that you do not congregate in areas outside of the school buildings. Now, clearly, this decision will impact our statewide assessments. This morning, the U.S. Department of Education invited states to apply for waivers, and OSSI will seek a waiver for the 2019-2020 school year to cancel statewide summative assessments, including PARCC and DC Science. On meal sites, beginning April 1st, the district will add 10 meal sites for all students, bringing the total meal sites at DCPS locations to 29 across the city, which are complemented by many meal locations at charter schools. These DCPS sites will provide lunch and a shelf-stable breakfast for all residents under the age of 18 on weekdays between 10 a.m. and 2 p.m. And residents can find the full list of meal locations at coronavirus.dc.gov under the Meal Sites tab. On related facilities, the current operating status of our public libraries and recreation centers will also be extended, and libraries and rec centers are expected to reopen also on April 27th. And effective immediately, all DCPS and DPR playgrounds will be closed. The district's outdoor public spaces, including parks and fields that we cannot lock, will of course remain open, but while they are open, we are reminding residents to continue practicing social distancing on these locations. This includes standing 6 feet apart and enjoying these spaces only with members of your immediate family and not with other kinds of group play or group activities. Lastly, a word on early childhood centers. This unprecedented situation is presenting us clearly with new challenges, and one of these is the need to ensure child care for children of our critical healthcare workers who are serving on the front lines. We expect shortly to stand up additional child care options for our critical healthcare workers in the coming days. And we have had very productive discussions with the Hospital Association and the Primary Care Association to identify the specific needs. We will share additional details with those families soon. Right now across the city, we have more than 50 child care centers that have continued to operate to meet the needs of their families, and most of these centers are our home-based locations. We encourage additional home-based and other providers to consider remaining open to meet the needs of families, and if you have questions or require additional information on how to do so safely, please reach out to your contacts at OSSI directly. Thank you, and I will now turn it over to Deputy Mayor John Falchicchio, Acting Deputy Mayor John Falchicchio, Chief of Staff.
Thank you, Paul. My name is John Falchicchio. I'm the Acting Deputy Mayor for Planning and Economic Development. Today we're joined by Ward 5 Councilmember and Chairman for the Committee on Economic Development and Business, Kenya McDuffie. Councilmember, thank you for being here and for your partnership. One of our top priorities while we still carry out the response is to start thinking about the recovery. And so that recovery takes on two approaches. One is to help organizations, and the other to help individuals. And so today, I'm going to talk a little bit about how we'll help organizations, and then Unique Morris-Hughes, our Director of the Department of Employment Services, will talk to you about how impacted workers can access resources. And so for organizations, we have broken it out into three types of aid, and that is federal, direct local, as well as local programs. And so for the federal aid, we announced that Mayor Bowser had submitted a declaration of economic injury to the Small Business Administration earlier this week. That declaration was accepted by the administrator, and it is now possible for DC-based businesses, small businesses, to apply for SBA-administered loans at the disasterloans.sba.gov website. Also today, we're announcing the direct local relief program. It will be a $25 million recovery fund, funded again with local dollars, and we're planning to open up the application process early next week. This program will provide short-term financial assistance to businesses, nonprofits, independent contractors, and self-employed individuals. The local grant program will be administered by DMPED, the Deputy Mayor's Office for Planning and Economic Development. We're also working with our sister agencies to identify programs that can help people at this time of need. Sister agencies including the Department of Housing and Community Development, which will use federal funds like the HOME program and the Community Development Block Grant program to provide direct rental assistance to low-income residents and economic relief to businesses in our neighborhoods. More details about DHCD's effort will be announced in the coming weeks. We also have programs within the Department of Insurance, Securities, and Banking. One such program is the Collateral Support Program that ensures small businesses with limited access to credit can get loans they need to stay open and invest in their business. That program is currently up and running and can be accessed through the Department of Insurance, Securities, and Banking website. As Mayor Bowser emphasized, we're all in this together, and we're all going to get through this together. That includes our small business community. I want to bring up Director Unique Morris-Hughes of the Department of Employment Services to talk about how workers in D.C. can access unemployment benefits.
Thank you, Deputy Mayor Falchicchio. My name is Dr. Unique Morris-Hughes, and I am the Director of the D.C. Department of Employment Services. And I want to thank Mayor Bowser for her leadership in taking swift action to help D.C. employees and employers. Today, under the leadership of Mayor Bowser, we are taking action to allow continued support for District of Columbia workers who will need to file unemployment insurance benefits during the public health emergency due to COVID-19 pandemic. These actions and waivers include eliminating the 7-day waiting period to receive benefits. Also, eliminating the requirement to be able and available to work. And due to council emergency legislation, removing the work search requirement for those affected by COVID-19. As of today, 11,844 D.C. workers filed for unemployment insurance. These waivers will help in an effort to expand coverage and ensure a more swift turnaround period for district workers who have become unemployed or partially unemployed as a result of COVID-19. These waivers will remain in effect until the end of the public health emergency. Based on the increase in call volume and wait times, we at the Department of Employment Services encourages everyone to visit our website, www.does.dc.gov, to review important information with regard to UI benefits and workplace rights. Similarly, claimants are encouraged to apply for unemployment insurance benefits online at dcnetworks.org. For more information on how we can support D.C. workers and D.C. residents, I also encourage you to visit coronavirus.dc.gov for the latest information and guidance. Thank you very much.
Let me just invite Councilmember McDuffie to speak on behalf of the council.
Thank you, Madam Mayor. I want to just take a moment to thank the mayor, all her folks who are working with her, Dr. Nesbitt, city administrator. On behalf of Chairman Mendelson and my colleagues at the council, we've been working around the clock to try to make sure we respond in a way that addresses the adverse impact that residents across the District of Columbia are experiencing right now. I was proud to be able to work with the mayor and my colleagues at the council, CFO Jeff DeWitt, to pass emergency legislation earlier this week. And as you see, with the announcement by the Deputy Mayor, we are already started to put the structures in place to try to provide the relief that residents have reached out to seek. We know ultimately that there's going to be more that residents are going to ask for. And we want you all to know that we're working around the clock to try to respond in kind. We hope that the federal government will provide additional relief, but obviously we cannot wait for that. And so we are all in this together. Again, on behalf of Chairman Mendelson and all of my colleagues at the council, we ask that you continue to bear with us and work with us as we try to get through and try to flatten the curve. And so, again, we appreciate all that's going into this, Madam Mayor, and your administration. And we just hope that folks continue to work with us and that we try to provide as much relief as possible given the limited resources that we have here as a city. Thank you.
So that's our health update, some updates on operations and updates on the resources that are currently available for businesses and DC residents. We'll take a few questions. Yes, Mark?
So the extension of the restrictions, could you, again, remind us to define mass gathering? And then also, does this also extend to restaurants, bars, churches, movie theaters, those restrictions that you put in place?
It does. It extends to all the gathering places that have been noted. We will update the order to reflect the new date. And if there are any changes, I think our last order had the number at 50. There's some updated guidance, I think, from the CDC, but we will update the mass gatherings order to coincide with our approved emergency.
So just to be clear, so you are extending the closure of restaurants and bars through April 27th?
Yes.
And mass gatherings is now defined by the CDC as 10?
Our order is at 50, I believe, and if there's any change to that, we'll issue it with the update with the date. Yes.
Mayor, has there been any consideration or discussions in your administration about issuing a shelter-in-place order? Has that even been discussed at this point?
We certainly are advising people to stay indoors. We have a number of workers that are going to continue to be working throughout our city, we know, and our essential employees that are going to be working. We're extending our mass gathering order, and we're reminding people that social distancing includes their immediate family. So we have virtually shut down our thriving economy in Washington, D.C., so that we can blunt the curve and get back to regular business just as soon as possible. Yes.
The Department of Corrections, as you know, they quarantined 50 or over 50 inmates yesterday. As a result of how the quarantine went down, the union representing the officers is asking for the warden and other jail leadership to step down, and they said that they didn't have enough protective equipment. They only had masks and gloves and were uncomfortable performing the quarantine. One officer was spit in his face by an inmate. So I'm wondering what your response is to that, and if the DOC has more protective equipment available.
I'm actually not familiar with what you're talking about from the union leaders, and this is my message to everybody that's working with us. We're in unprecedented times, and we're calling on all of our workers and their union leaders to communicate any questions or the concerns they have to our Emergency Operations Center, and that is certainly where they can get the response that they need. Yes.
Yeah, Mayor. Just kind of curious, in terms of the schools, I mean, can you give us a sense as to how you came to the decision to extend the closure of schools? Because before you talked about, the science and the value of closing schools is unsettled. So how did you reach this point of closing the schools for a few more weeks?
Sure. So Dr. Nesbitt advised me today that in order to really know that our strategies for social distancing are working. It's going to require some period of time after which we started these social distancing strategies to see the level of infection and the trends in the District of Columbia. And we know today that April 1st, we would not have had enough time to see if those strategies were working. So we made the decision today to extend. And everyone knows, and I'll repeat, that as this situation evolves, it may require that we update any level of guidance that we give on any given day. And this is what we know today, that we won't have enough time by April the 1st to measure whether our strategies are working. So we will extend that period of distance learning until the 27th. Yes.
Do you know the test results of the inmate who was tested?
I don't know about no, I don't. Yes.
Can you update us on any first responders testing positive other than the 3 firefighters we were told of yesterday?
I am told, and I think MPD will release some information a little bit later, that a detective at MPD has tested positive. He is a Maryland resident, and we will work with our internal protocol for tracing for our first responders and confirmation with the state of Maryland.
There's just one D.C. police officer right now.
Yes. Yes.
So are several D.C. police officers within the detective division under quarantine?
We haven't. I don't think that the Department of Health, we literally got this information confirmed before I walked in today. The Department of Health will consult with MPD and, or actually MPD and Fire and EMS infectious control with the Department of Health and anything else we learn from Maryland. And then DOH makes recommendations on any workforce changes. But immediately, in the meanwhile, the chief has removed those detectives and is cleaning the facility, but DOH will make any recommendations on workforce changes. Yes, workplace changes, I should say.
Mayor, is there anything else you can tell us about the 59-year-old man? I believe that Dr. Nesbitt was saying he may have had contact with another confirmed case.
Dr. Nesbitt has briefed out on what we can share.
Do you have any reports or projections about how the closure of all these DC businesses until the end of April essentially will affect the economy in the district? We
are pulling together a very comprehensive assessment with the CFO on our economic impacts. As you can imagine, many of the things that have already been mentioned in terms of relief have a huge impact on the district's economy. And we are in some ways situated better than a lot of jurisdictions in that our fundamentals of our economy are very good, that we have reserves, and we know that we will have to tap into a lot of our resources to help get us through this. But what's also worth mentioning is that and every household can understand this because this is what everybody is going through. What we have coming in is also going to dip. So when you talk about hotels and restaurants closing, they represent a lot of tax dollars that we won't collect. So while we are looking for ways to give relief to businesses and residents, we're also looking at our own cash flow as a city and determining how we're going to maintain our operations and provide relief. So that is the big discussion that we are having. Yes.
Actually, heading back to schools, I'm wondering if you're concerned about any sort of violence and safety, and if so, how does the district plan to address that, just with kids being out?
Well, we're always concerned about our children, and I hate to always go to children being home means that children will be violent. So we give them the benefit of the doubt, but we also make sure that all of our police resources are being deployed in ways that are productive. And our chief, of course, while we're going through this pandemic, I'm getting the same police briefing that I get every single week to listen and hear from the chief how our resources are being deployed and how they're working. Yes.
Mayor Bowser, on unemployment insurance, and if I'm trying to understand the restrictions that have been loosened, if somebody was unemployed prior to the coronavirus impacting the economy, had left their job voluntarily a week or whatever, 2 weeks before, but now finds themselves unable to find work because of the coronavirus, are they also in this category of people who restrictions are eased on?
Yep. So the flexibility that the mayor is offering and waiving are for those that are impacted because of COVID-19. For those individuals that may have been out of work and voluntarily left their work prior to the presence of COVID-19, we will work with them on securing benefits or trying to secure future employment.
Nesbitt. Kind of curious. I mean, can you quantify the number of beds you need in the district, and how will you go about getting those beds? Just kind of get an exact sense.
So there is no exact number that we have identified. What we have been looking at to date is that the current number of acute care beds that we have now is very similar to the number of beds that we have during the fall and winter time. So that's how we have been looking at it. What we have been monitoring very closely is the number of ventilators that we have in the event that patients become acutely ill, requiring ventilator assistance, and how the hospitals and health systems are looking to increase or surge their intensive care capacity or ventilator assistance capacity.
Can you tell us how many ventilators the city has?
Yes. We have 404, and 147 are currently in use. 257 are available.
How many ICU units?
We have 351 ICU beds in the city. There are currently 69 of those beds are available, and that has increased over the past 2 days. 2 days ago, there were 40 that were available. So there's a decrease. That number is very fluctuant. But it's important to remember that a hospital can flex their capacity, that general medical surgical beds that are not intensive care beds can easily become, or readily become, I shouldn't say easily, can readily become intensive care beds or ventilator assistance beds.
Can you help us just understand and kind of put in context, in a normal situation a month or two ago, 351 ICU beds with only 69 available, was that typical? Is that unusual to have that few? Can you kind of put it in context?
Well, 2 days ago, there were 40 beds available. So hospitals, when you eliminate your non-essential services or your elective surgeries, then you have less of an ability for complications to occur and the need for intensive care beds that may be used post-surgically. So the dependence on those types of beds decreases in your facility. Is that helpful, Mark? Okay.
Actually, can you go back to the emergency child care centers, Deputy Mayor, if you don't mind? Kind of curious as to who will qualify, how much will they cost, if any details around that, and if kids older than typical child care age would be able to enroll.
Yeah, thank you. So we, as I mentioned, we've been working very closely with the Hospital Association and the Primary Care Association to identify the priority personnel who we think should qualify for these slots. We are currently looking at standing up these centers in a few new locations. It is our desire to have them cater for infants and toddlers, but also for school-age children, so 5 to 12-year-olds. And in terms of the payment structure, we're currently working that out. We are fully intending to take advantage of the subsidy payments that the government offers, the local government and federal government offers, in addition to some other sources of funding.
Let me just also add, we've gotten a number of questions from residents about some credentials or program that they are enrolled in the district. So let me start with the Department of Motor Vehicles. We have extended the expiration dates for DMV credentials and registrations. So you do not have to feel the need to have those registrations updated, and we will go throughout the public health emergency. Likewise, for some of our other benefits like TANF or SNAP food stamp benefits, if your eligibility is expiring during a public emergency, we have been able to extend those dates throughout the public emergency, so you do not need to try to come down. We have our staff available to answer your questions, and we will continue to look for ways to help. Similarly, I want to invite everybody who has worked with our Department of Consumer and Regulatory Affairs to familiarize yourself with their website and all of the services that can be provided on the internet, so that you do not have to come down to DCRA. Yes.
Last question. So for the 59-year-old man who died, have you had a chance to speak to his family? And now do you have any message for his family?
As I said at the top of my remarks, we certainly extend our condolences to them on their tragic loss, and likewise everyone who is recovering either in the hospital or at home. We're pulling for you to get well soon, and I think that you have heard from Dr. Nesbitt previously. At some stage, in addition to reporting numbers of infections, we will soon be able to report people who are in recovery. So we look forward to sharing that information with you as well. Okay, thank you very much, everybody.